Hello and welcome to Crack the Board. If you're new to this channel is dedicated to helping you excel in the USMLE by sharing high-yield questions and answers. So please make sure to subscribe, like, and share the channel to support our journey. Today's video is dedicated to gross anatomy and embryology. Let's have a look at the first question. A 47-year-old woman presents to the clinic with speech difficulties following a mild stroke. She speaks fluently and can understand spoken language, but frequently uses incorrect or nonsensical words in her sentences. When asked to repeat simple phrases, she is unable to do so accurately despite understanding the request. Her ability to follow commands remains intact. The most likely affected brain region is in which of the following areas? A. Anterior commissure. B. Arcuate fasciculus. C. Inferior occipitofrontal fasciculus. D. Medial forebrain bundle. E. Uncinate fasciculus. The correct option here would be B, arcuate fasciculus. The arcuate fasciculus is a crucial structure that connects two important language regions of the brain. As illustrated on the image provided on the right side, the Broca's area, which controls speech production, and the vernix area, which is responsible for speech comprehension, is connected via arcuate fasciculus. The patient's speech comprehension and spontaneous fluency are normal, indicating that both the areas, the vernix and Broca's, are functional. However, the inability to repeat spoken phrases along with the paraphasia points to conduct aphasia, a condition typically caused by damage to the arcuate fasciculus. This explains the inability to repeat phrases, as this bundle of fibers transmits the signals between the two language areas, and damage here disrupts the communication needed for repetition. Let's have a look at why the other options are incorrect. Option A is incorrect because the anterior commissure is a bundle of fibers that connects the temporal lobes and has few axons that connect the two sides of the olfactory system. Option C is incorrect because the inferior occipitofrontal fasciculus connects the occipital lobe to the frontal lobe. Since the occipital lobe's primary function is vision, this fasciculus is not related to language processing. Lesions in this tract may affect vision and spatial processing. Option D is incorrect because the medial forebrain bundle is involved in the regulation of emotions and alertness by connecting the hypothalamus to various regions of the cerebral hemispheres. This pathway carries aminergic fibers, and a lesion in this pathway would more likely cause disturbances in mood or behavior regulation rather than impair speech or language. Option E is incorrect because the uncinate fasciculus connects part of the anterior temporal cortex in the temporal lobe, which is involved in memory and emotional processing, with the orbital cortex in the frontal lobe, which plays a role in higher cognitive functions. Although the temporal lobe has some involvement in language, this specific tract is not crucial for speech production or comprehension. It is more involved in emotional and cognitive processing, meaning a lesion here would not typically result in speech deficits like the ones described in this case. Let's have a look at the second question. A 2-year-old boy presents with abdominal pain and blood in his stool. A technetium 99M scan reveals an ectopic gastric tissue in a Meckel's diverticulum, which has become ulcerated and is causing bleeding. The diverticulum is surgically removed. Meckel's diverticulum is a remnant of which embryonic structure? A. Cecal diverticulum. B. Dorsal pancreatic bud. C. Hepatic diverticulum. D. Ventral pancreatic bud. E. Vitelline duct. The correct answer is E. Vitelline duct. Meckel's diverticulum is a remnant of the vitelline duct, which originally connects the yolk sac to the midgut during early embryonic development. As the midgut undergoes development and rotation, the vitelline duct usually obliterates. However, in some cases, it persists as a small outpouching of the ileum, which is known as Meckel's diverticulum. This structure can remain asymptomatic but may become problematic, as in this case, when it contains ectopic gastric mucosa, leading to complications such as ulceration and hemorrhage. This is why the boy had rectal bleeding. Therefore, vitelline duct is the correct answer in this case. Let's have a look at why the other options are incorrect. Option A is incorrect because the cecal diverticulum is part of the early development of the cecum and the appendix. It forms from the caudal limb of the midgut loop during embryonic development. While the cecal diverticulum is a critical structure in the development of the intestines, it does not relate to Meckel's diverticulum, which originates from a different structure. Option B is incorrect because the dorsal pancreatic bud gives rise to most of the pancreas, including the accessory pancreatic duct and the distal part of the main pancreatic duct. Option C is incorrect because the hepatic diverticulum, also known as the liver bud, is responsible for giving rise to the liver, gallbladder, and the extrahepatic biliary ducts. Option D is incorrect because the ventral pancreatic bud forms the uncinate process of the pancreas and the proximal part of the main pancreatic duct. While this is important for pancreas development, it does not relate to the development of Meckel's diverticulum or the ileum. This concludes today's set of questions. Thank you for watching.